Hi. So, continuing on Prakruti diagnosis, I am looking to talk about something that is called as change in Prakriti and how it affects. In simple terms, I am going to talk about how change of one season affects the human body. Also, there are various reasons within the human body which vary with age groups. So I'm not picking that. I'm just picking a very broad status. Let us assume that we have a patient whose age is 24.2 years. Alright? He is in the tropical zone. So the average annual temperatures are somewhere around 27 degrees. We're just limiting this to at this point, not anything else. 24.2 is the ideal Vedic lifespan among the 5 dosh, considering 121 years. So at 24.2, this individual is moving from Kaph into Kaph Pit. So the dominance of Kaph will persist without a doubt. Though it will have diminishing impacts, and with Pit becoming more dominant, the chances are that you have to understand this is the age when the individual is going to go through a lot of hormonal changes. In a tropical zone, when the temperature is 27 degrees approximately, you can always take it that the influence of Pit is relatively high, because in general the temperatures wherein human life is easy is between 5 degrees and 45 degrees as of the present circumstances that we see across the globe. So at 25 degrees it is, or 27 degrees, it is comfortably a Pitta situation. The influence of Pit, the climatic influence, is that the heat that the body is exposed to induces two things. One, as a first, it induces the body to conserve water, which means you are not losing sweat, you are not losing urine as well. You are retaining and water, and that water that you retain helps you keep yourself hydrated. Being in a conflicting state from Kaph to Kaph Pit, you are in a state where when such an influence of heat comes, you tend to lose water and get desiccated. So, while in hormonal transition, you are likely to sweat more, likely to give way to dehydration and associated signs of weakness that come with dehydration. This is the normal condition. So this individual in a hyperpitta state is going to face dehydration. That is understood. So typically, if it was the summer season, this person is going to sweat a lot more compared to anyone else. Not because of the external temperature as much, because the body in that mode is induced to conserve water, but by nature of its kaphaj state, which is going into a pitta state, it is losing water, and that is what will be seen. It is difficult to explain, and it looks like very lame as I say this, but again, like in the past I've said, I don't have a whiteboard to explain this in terms of mathematical equations as it works out. But yes, you will be losing water, dehydrating, and it is common to see youth in certain age groups sweating a lot. Now, in the summers, we picked on the season summers, and we are talking of transition from summers to we will go towards monsoons. So there is again going to be a transition of movement towards Pith. Now, interestingly, from Pith towards Kapha. So interestingly, body is moving from Kapha to Pith. Temperature outside is moving from Pith to Kapha. The mathematics, since you are not measuring it, gives you an assumption that if both are equal, they cancel out and thing remains as it is. But this does not remain the same. While the transition phase for the human body ideally was 24.2 years, this transition is only going to happen in 2 months. So the rate of change for the external climate is going to be much higher, much faster than the change of the state within the body, which is going to be much, much, much longer. So now, even if these were conflicting states, the dominance of the phase which changes in a much shorter span will have an impact on the body, and the body will try to adjust to it. Now, when this happens, your BMR or basal metabolic rate is going to change. It is established even in modern science that when temperatures change across the temperature range, the basal metabolic rate does change. So I'm not talking anything new. In Ayurveda, basal metabolic rate is not mentioned, not calculated. So when I do this or when I say this, this is comparative. But it is definitely understood and clearly mentioned that states of temperature outside the body and other factors inclusive do impact the functioning of the body. This is also established in biochemistry, wherein temperature or humidity impact the isotonic environment between the two conditions or the two surfaces where the cell membrane is inside and outside, and there is a pressure gradient that is created which will lead to dehydration or desiccation. So instead of an isotonic condition, it has shifted to a hypertonic within the cell and hypotonic outside the cell. This biochemistry variation, this thermodynamic understanding, this application basis of quantum medicine, theoretical sciences, helps you analyze and understand what Ayurveda says when transitions from one phase to other happen. At the same time, now this was the Prakrutic state or the natural state. If this person had a Vikriti, say he had or she had a chicken pox. Now a chicken pox is a hyperpitta state with high fever, signs of pneumonia or respiratory infection and eruptions all over the body. Majorly pittaj, but also has kaphaj components associated with it depending on the srotas where it is impacting. It also has a vataj component because there is a lot of pain and burning. All three dosha are vitiated in one form or the other, and they all seem to be rising. Now that is a peculiar state, but that can happen, and if it happens aggressively that all three dosha are extremely vitiated, we call it as sanni pataj. That is the term sanni pataj, wherein meaning all three are vitiated together. Sandipataj conditions may be treatable, may not be treatable, depends on the aggressiveness of the condition. This may be seen in the modern medicine context that if this is progressive towards multi-organ failure, revivals may be difficult or incompatible. Sandipataj also means that it's not just the three dosh, but the different srotas are all deranged, getting deranged, particularly the pranava, the annava, and the mutra and purishva srotas. If these four are impacted concurrently, you will see that multi-organ failure is ensuing, because this covers lungs, heart, liver, spleen, kidneys, and even your rectal region. All these are also very essential parts of life. Injuries to these can be life-threatening, and they are also labeled as marm within the Ayurveda context. I am not going to detail about marm here, but diagnostically speaking, it is important and imperative to listen to the patient's clinical history, because when the clinical history is read, when the patient details the clinical history, it is in that duration that you are able to note down, and it is important to write down what the patient is saying. You can ask the patient to stop for a while, tell him that you are taking notes of what he is told, and you will listen to the story further. Let that story come in parts, but all the indicators that he is telling you, when you put them down on paper, it also gives you the semblance of in what story, in what line of the story has the patient indicated if Vata is aggravated or degraded, Pitta is aggravated or degraded, Kapha is aggravated or degraded. At the same time, you can also manifest the psychological states as Sattva, Rajas and Tamas being aggravated or degraded. You can also try to put this to correlation to the specific srotas that the patient is reporting, and then try to have a picture of the different srotas being a part of the system. If there are multiple srotas involved, always remember 2 srotas are essentially going to be a part of it. 3. One is Anava srotas, one is Raktava and Rasva srotas, that is the circulatory system, and the Manova srotas or the neurological and psychiatric system. So, history is going to define the clinical diagnosis. It is very much the same as in modern medicine. It is said that patient's history will define how do you go for the next step. The only asset they have that they talk about as much is additionally investigations. Investigations in Ayurveda are mentioned, but they are not physically done because they are not feasible as on date, more because of hygiene and touchability and other reasons. Also, the development of the senses that we have. We do not try to develop our senses, train our senses to be able to feel the touch, the smell, the taste, the sight most of the time. Most of the time we find it abhorring and we just try to move away from the substance that is to be tested. But Prakruti analysis is one single power tool, one single powerful mechanism which can help you assess what is coming, what is the future of progression, and also help you trace back where it started from. It is not easy to do it clinically on the sheet of paper for simple 2 reasons, and they are practical reasons. One, most of the physicians find it very cumbersome to write it down on the paper. And secondly, the patient is not willing to give you as much time. At the same time, the economics of it does not favor, because the patient is hardly willing to shed enough pockets to spend time with the physician and understand exactly how the diagnosis is being done, what factors of his story are explaining what are the possible occurrences. Given the absence of it, investigations play a big role, because from the doctor's chamber they are shifted to somewhere where something is happening with the patient physically or mentally or both. Therefore, I just go back to what I have always been saying, that AYURScan is your tool where you can not only see the picture of different srotas, how they are presenting, but also draw the linkages between the srotas and the patient's clinical history, and thereby come to a better diagnosis than what you may otherwise be doing. Not to say that you are doing wrong, but just to say that you can be much better and better. Concentrate on Prakruti analysis, concentrate on factors that work with Prakruti, and you will definitely get Ayurveda right, with minimal medication, with easier lifestyle changes, and a much enhanced and broader spectrum that otherwise is missing, just because our texts are not complete as of the modern references required. They do not meet what we study at school. They go missing with a lot of information that is required as on present date for our effective presentation. So diagnostically, Prakruti analysis, I will say once again, is the best thing you can do, because with AYURScan you have it presented numerically, tabulated, and even graphically. Thank you.